Not only is the Prime Minister refusing to rule out future decriminalization across the country that has just failed in BC, he's now just announced he plans to spend even more tax dollars on narcotic opioids. According to the Vancouver Chief of Police, 50% of the recovered hydromorphone was originated with government programs handing it out as so-called safe supply. This program has led to a 166% increase in drug deaths across the country since it was brought in. Why won't he accept my common sense plan to stop giving out deadly drugs and start giving out treatment?
I don't know that any Canadian would think that adding more ideology to our approach to public health, dealing with the opioids epidemic is a solution, and yet that's the only thing that the Conservative Party seems to offer. We will continue to be grounded in a compassionate, science-based approach that works with local partners, that attempts to provide the kinds of wraparound services, whether it's housing, whether it's healthcare, whether it's addiction treatment and recovery, whether it's culturally appropriate services for those who need it. We will continue to be there to help heal people, not imprison them.
They are there to help kill people right now. That's exactly what they're doing. And not only is his policy killing people, but this Prime Minister is by far the most radical ideologue who's ever occupied that job. Yes. But always with these radical policies comes profiteering. The companies that are making the money off of the opioids that are funded by Canadian taxpayers, and it is indeed sick, Mr. Speaker. Will the Prime Minister agree to release all of the contracts for those pharmaceutical companies?
We are facing right across the country a toxic drug and opioid epidemic that is taking lives left, right, and center, that is hurting communities, that is hurting family members who are losing loved ones at an alarming rate that is something we need to respond to. And we have continued to work, jurisdiction by jurisdiction, in thoughtful ways to try and do everything possible to both keep communities safe and to keep families from suffering these further losses and support people struggling with addiction. We will continue to be grounded in evidence and support. Right on.